Chair. Thank you, Madam Speaker. It's great to see you in the chair, and it's great that we're having this debate today. I want to thank our honourable colleague from Brantford Brant Six Nations. He's got a new change, I believe. If that's the name? I hope for sharing his time with me. Madam Speaker, today we rise to talk about C-14, but if you will pardon me, I'm going to talk about who's impacted by C-14.
I have no notes.
And a piece of legislation that we have before us today in S-233. S-233 is an act to amend the criminal code, making it an aggravating factor at sentencing that the victim of violence was a firefighter, a paramedic, a nurse, or a healthcare worker. Madam Speaker, I've said this a million times over the last decade of me serving in this House, is that our brave men and women who put their uniforms on every day, they do so knowing that they are going to experience some of the worst in our communities, see people at their lowest point. You'll see some horrendous sights, smells, sounds, but yet they put their uniforms on every day. They go out the door to serve your country, your community, my family, your family, because they care. They want to make a difference. These are nurses, paramedics, firefighters, police officers, correctional officers, social workers, psych nurses that are on the streets administering care to some of our most vulnerable. Madam Speaker, they're facing an epidemic of violence perpetrated against them. How far we have fallen where it's okay to punch a nurse as she is taking your temperature, or a firefighter that is responding to a 911 call, which, by the way, Madam Speaker, did you know that a firefighter can't say no or can't stop what he's doing or they're doing and say, no, it's unsafe? They have to respond. They have to go into those burning buildings. They have to go towards danger, at risk of their life and the safety of their colleagues. But what we are seeing is that, I don't know what, I have no idea, I'm at a loss. We're seeing these acts of violence perpetrated against them. Paramedics having to wear bulletproof vests because they've been stabbed or they're shot at. They're attacked just doing the job. Nurses behind closed doors being attacked by their patients. Madam Speaker, when I stood in the House in debate of C-321, I read out some horrific stories that have been shared to me. I brought some of them with me, just some. You know, the paramedic that was thrown down the stairs and beaten and both legs broken during that call. A firefighter or a BC ambulance attendant in Duncan and Victoria that was knocked out unconscious. A firefighter stabbed. It is horrific that we're hearing. But what we have seen over the last 3 years is we have worked collaboratively across all sides of the House. We got C-321 passed at all levels, unanimously in this House. And we did the same in the Senate. Unfortunately, an election was called. And so C-321 fell off the order paper. It disappeared. But over the last month, since we have been back in the House, the Senate side, the leadership of the senators, saw the importance of getting this passed so that our first responders and healthcare workers knew that we had their back. So they brought it forward and they passed it at all levels, and they reported it back to this House late last week. Now, Madam Speaker, the minister stood up and said, he doesn't care who gets the credit. I don't either. But I do know one thing, is that we're in a minority parliament. This bill, C-14, still has to go through all stages in committee. So it's going to take time. There is good work, good discussions being taken on all sides of the House right now about friendly amendments and what have you. But we could send that message to our first responders and our healthcare workers that we care. And we could pass S-233 like this week and not delay by waiting for C-14 to pass. You know, Madam Speaker, when the stakeholder groups, the nurses associations, IAFF, when they all found out that it was put into C-14, they were very happy. But then reality sunk in that it's going to still take a long time potentially. And what happens if this parliament falls? It then is scrapped again. You know, we talk about this showing leadership. Leadership is about putting our partisan sides, our partisan ways behind us and passing legislation that really matter most. The minister said this, let's do what we were sent here to do, work together and work on the best interest of, best interest of Canadians. That's what C-321 was. That's what S-233 is. Yep. They're watching today. The IAFF, the International Association of Firefighters, over 100 firefighters are going to be here in Parliament next week for their lobby days. Do you want to know what their #1 request is in their legislative days or their lobby days? Passing S-233. Here. Getting protections for them. And furthermore, they've been asking for it for years. Transit workers had it within months in 2015. The very same things that we're asking for, transit workers had it. Yet we expect paramedics, nurses, healthcare workers, firefighters, first responders to go into danger and to suck it up. And they're fed up. They're fed up with being used as political pawns. That's what they feel like. We have a responsibility to those who protect us, not to play politics with their lives, with their safety. I'm hoping at some point in the very near future that I can stand and call for UC to see this bill, S-233, passed at all levels. I will work with all sides on this. I've proven that over the last decade, that when it comes to our first responders, when it comes to those who serve our country and our community, I'm fiercely defensive of them. I'm a champion of them. And I'll work for all of them. And I'll work across all sides to get something done that benefits them. But don't cross me. And right now, the firefighters, the paramedics, the healthcare workers, they feel like they're being used as pawns. And I think we can send a message. I hope this House can come together and send a message. The minister's words gave me hope. And those who are watching also got hope from it. So, Madam Speaker, I will cede my time very shortly here. I just want to say I thank my honourable colleague from Brant Six Nations for allowing me the time to talk about S-233 as it pertains to C-14. I hope our friends across the way, I know we have other champions of first responders and our healthcare workers across the way. I've worked with them for the last decade. I hope they can do whatever they can within their ranks to see it so that if we do come to this House, before this House, and call for UC, that we'll be able to support it. And once and for all, our first responders, paramedics, healthcare workers, that they will know that we cherish them and we have their backs. Thank you.
Hear, hear, hear. Questions and comments, General Parliamentary Secretary, the Government House Leader.
Yes, so thank you, Madam Speaker. And, just to say, in terms of our first responders, I think that all members of this chamber understand, appreciate, and value the work that they do. In fact, the Parliamentary Secretary to National Defence is an honorary member of the International Firefighters Association and has been a very strong advocate. I remember her sitting beside me as the Deputy House Leader, constantly talking about and advocating on firefighter issues. I don't want to politicize this. I think that what we need to recognize that C-14 is legislation that is widely supported in all the different stakeholders and sectors of our communities, and I think it's substantial legislation, as I posed the question to the Conservative Shadow Minister, and that is, why not recognize the true value of the legislation and what the member's referring to is within this legislation, and make a commitment, an honest commitment, to actually see this legislation pass before the end of the year. I believe that if, with the will of this chamber, we can make that happen.
Hear, hear. Honourable Member for Prince George Caribou. Caribou, Prince George.
Thank you, Madam Speaker. Madam Speaker, we have a piece of legislation before us, S-233. It's gone through all levels of committee. My comment to our honourable colleague is work with me and let's get S-233 passed as soon as tomorrow. It doesn't have to go through a lengthy process. And we can send that message to the firefighters, paramedics, healthcare workers that are watching this debate right now and that feel that their safety and concern and safety is being punted further down in the future when we can actually send that message today. The work's been done. Let's do it.
Commentaire? Questions and comments. The Honourable Member for Bruce Grey, Owen Sound.
Thank you, Madam Speaker. And I just want to follow up with my honourable colleague, a little bit of the same vein of questioning here. This member had the opportunity to ask the Justice Minister, and he, very correctly stated he's not worried about who gets credit. But the member brought up in his speech the concerns about getting this through and getting it through all stages quickly, not only to send the message for next week, but the possibility that this Parliament may not even exist 3 weeks from now, based on the sort of the posturing by the Liberal government that they sort of indicate they want to call an election. So would the member agree, if we can get this through, we're at least getting something done that C-14 may partially address, but that this bill from the Senate that this member formally brought forward as a private member's bill is so important for first responders?
The Honourable Member for Caribou, Prince George.
Right. Madam Speaker, to my honourable colleague, I don't have a crystal ball in front of me. But what I do know, I deal in facts. We don't know what next week will bring, but we have S-233 here, which is a complete bill, gone through all the process, and can be passed today. That is a good news story for this House. If whatever happens next week or in the near future, who knows? But what we can say is that we came together and we valued our first responders and healthcare workers. We managed to get something done, and it can be done today.
Questions et commentaires, questions and comments. The Honourable Member for Langley Township, Fraser Heights.
Good. Well, thank you, Madam Chair. And I want to thank my colleague for his advocacy, his tireless advocacy for first responder safety and for introducing private member's bill in the last Parliament, now again this time. My question is, where would his private member's bill from the last Parliament be today if Prime Minister Trudeau hadn't selfishly prorogued Parliament for purely partisan reasons?
The Honourable Member for Caribou, Prince George.
So it would have been law. It would have been law. That's the sad thing, is that it would have been law. But I can say this, is that all sides of the House, both here in Parliament and in the Senate during the last Parliament, we worked tirelessly to get this done. You have colleagues that are in this House right now worked tirelessly to get this done. And so, which is why it's almost, it is a plea, because this is weighty stuff. This is weighty stuff, Madam Speaker. Hearing the stories of another firefighter attacked or somebody that has died by suicide because they're done with the violence, healthcare workers, nurses that can't go back to work because of the violence that they face each and every day. S-233 could be passed right now. C-321 could have been passed last Parliament if it didn't dissolve. The work has been done, the heavy lifting has been done, and the sacrifice is done every day by our firefighters and healthcare workers. Let's come together and pass S-233.
Hear, hear.